Thank you for sticking around. It is No Copay Radio on KOSI 101.1, brought to you by Dr. Cog, the Denver Regional Council of Governments Area Agency on Aging, 303-480-6700. I'm Murphy Houston. My partner and the lady that runs the Area Agency on Aging, Jayla Sanchez-Warren, is here. And we have I won't say old friend, a good friend back with us. Jayla?
Yes, we do. Gary is the President and Chief Executive Officer for 365 Health, formerly the 9 Health Fair. Gary's been around for a long time in Colorado. He served as the CEO for Connect for Health Colorado, and then he was the CFO for the Colorado Health Foundation and the COO for Regis University. And this is the part I didn't know. An Emmy-winning producer and executive for Walt Disney Studios. I didn't know that.
Yes. It's Gary.
Yeah, that was in a former life.
Yeah, but that must have been. So yeah, it's Gary Drews. How did you make that switch? Now we're getting off track here, but I mean, how did you go from Walt Disney Studios? I see you got credits with HBO, CBS, and now you're running. It's called 365 Health. How'd that happen? What a transition!
Oh, it was a big transition. Yeah, no, I worked in Hollywood for many, many years, and really discovered a longing to give back to the community, and ended up finding an organization called Outward Bound, which is a wilderness education program, and ended up coming out here to Colorado to be their chief financial officer. And it took kind of a visionary guy to hire a TV producer to do that, but he did, and I've been working in nonprofits ever since.
Well, good for you, Gary. That's a big move,
that's awesome.
But we're blessed and lucky to have you. That's a big shift. Holy cow! Well, and so is this name change deal. What's going on? 365 Health, no longer 9 Health Fair. What does that mean for us?
Well, it's been a little while coming. The pandemic really impacted our organization. Obviously, 9 Health Fair for 43 years has run health fairs, literally thousands of health fairs now and screened 2 million people over those years.
Wow.
And then during the pandemic, of course, we weren't gathering in large groups. And so for 2 years, we had nearly no revenue coming in for our nonprofit. And so we had to, as they say, pivot and figure out how can we be relevant today and in this scenario. And lo and behold, the governor's office called New Year's Eve a year and a half ago and asked if we could start doing vaccine clinics in underserved communities around Colorado, which we of course did, and we've now run over 500 vaccine clinics and continue to run 30 to 40 a month, all in communities that don't have the same kind of access to care as most folks. And so what that opened up was the possibility of changing what we do. And so we still provide screenings through Quest Diagnostics, patient service centers, and at health fairs coming up this weekend, actually. But we added on one service that is making a huge, huge difference to these communities that we're serving, and that is adding the ability to have year-round telehealth. Text-first telehealth, which I can describe in a minute, but adding access to a doctor for the 1 million people in Colorado that do not have a doctor. And so now you can get screened, you can talk with a doctor about it, you can talk to a doctor about any other issues too, because it's 24/7. And so in doing that, we realize health is happening every day, so can preventive health. And really, the new name just represents our expanded mission and services, but still tries to hang on to the deep connection to the community that we've had all these years.
Wow, that's great news. Yeah, get deeper into that telehealth thing. That's big time. And I didn't realize, did you, Jayla? Well, you maybe did. 1 million people in Colorado don't have access to medical care? Is that what you said?
Yes, believe it or not. And, you think about folks in rural Colorado, the mountains, there's most of Colorado is actually a provider shortage area, especially for mental health providers. And the telehealth we're able to provide includes primary care and preventive care, but it also includes access to a psychiatrist, to women's health, to diabetes prevention. And again, it's text-based, so you don't have to have internet. And
Wow.
for folks
Yeah, that's so important, Gary, because that's the biggest problem, right? I mean, we saw a lot of people, a lot of organizations, including ours. We got money to buy, tablets and phones for people, but it was the service. They either don't have access to the service, they don't have good service, or they can't pay for the service. So having that ability to text is so important, especially for mental health. Isolation, right? Think about all those people who are in those rural areas and can't access mental health services, and now you can. What a life-changing opportunity there.
Well, Jayla, you're so right. I should tell you this story. We provide our service, which is called Health in Hand, and it's the package of a lab screening, a year's access to telehealth and education year-round to go along with it to help people learn more about preventive health. And so the Health in Hand service that we provide was purchased by the Salvation Army here in town in Denver. And we went out a couple weeks ago to provide this, offer it to the residents of their family building, which is taking folks in from off the streets, literally, and trying to transition them to stable housing and the like so that they can get back on track. And so these families lack so many things, of course. And so we ran into one single mother who was there with 4 kids. And she's eligible for Medicaid, but registered in another state. So she can't get Colorado Medicaid. And even if she could, accessing a doctor with 4 kids when you may be working an hourly job is pretty much impossible.
Right.
And so what this service allows somebody to do is to literally text a doctor. They answer within 60 seconds. And you can do this while you're on a break, working at wherever, McDonald's, and not need privacy, not need to make an appointment, but can immediately get access to the care that she or her kids may need. And so she described the scenario where one of her kids had an ear infection, and she had to delay treatment because she couldn't afford to go anywhere. She didn't have transportation, and the infection got worse, and they ended up in the emergency room. And so that's obviously not good for the kid nor the family, and this would have prevented that. And so, I forgot to mention that the service, which is also now this last week available to the public, is less than $100. So for literally $99, you can have access to a doctor as often as you need, 24/7 for a year.
Wow. For $99?
That is really good.
Oh,
we
my
need
gosh.
to talk, Gary.
Yeah, that's
We seriously need to talk. I need. There are pockets of the region that we have a really hard time serving, right? And I just need to check out if I can use my funding in this way. But I think I can, because there are pockets in the Eastern Plains. We serve all the way out to Deer Trail, and we serve all the way to Georgetown. We serve past to Deckers and beyond. So there are big areas of the region, Dr. Cog region, that are, like you say, underserved. And don't have access to medical services. And I've learned through partnering and contracting with other telehealth processes that people are really adopting this and they're using it. So I think this is wonderful. I think it's just so good.
Oh, unbelievable, Gary. You got to be so proud of that.
Oh, I am, and I can't wait to see it actually. The stories like the one I just described. That's what I'm waiting for. Is I think there's gaps in our healthcare system that we sense, but that the people that provide the larger services like hospitals and insurance companies and the like. There's people that fall through the cracks between those services, and that's what we're discovering, is the people that either can't get to care or don't even understand what preventive health may be, in that they can do something about it, and even if they're in hard-to-reach places. And so, Jayla, I totally agree. We were just talking a week or two ago with the Rocky Mountain Farmers Union, which represents 3,000 family farmers in Colorado. And if you imagine a family farm out on the plains, they're really nowhere near access to care or guidance on when to get to care and where. Right. And that's one of the other big pieces that's missing for most of our community.
Right. So important. We serve Eastern Plains. I've gone out to those farms, to talk to people, and we deliver Meals on Wheels out there, and so it's those are long dirt roads. Sometimes I think, where are we going? Are we lost?
Oh, that's exciting stuff, though. Gary, I got to ask, though, for people that are listening and hearing this for the first time, how do they get involved with this telehealth situation you're doing at 365 Health?
It's really simple, Murphy. You just go to 365health.org, and you can sign up there. And as I said, we're now available to anybody in the public, as well as groups like the Salvation Army and a number of others, the Rocky Mountain Farmers Union and the like. So you can literally just go on, sign up, have access to it right away. And so 365health.org. One of the things I do want to mention is that, since most of us, about 90% of Coloradans have insurance of some kind or other, you might not think that this is helpful for somebody with insurance. But as I know, my deductible is thousands of dollars.
Yes, most are.
And if I go to the doctor, which had to do recently, it's $270 for one doctor's visit for literally it was 5 minutes.
Oh boy!
And so you're not going to do that too often. And so for people with insurance, that's out-of-pocket dollars. So if you can, for $100, have access to a doctor is just a basic tool for, like I said, for either navigating or dealing with immediate sick care issues, or even better, using it for preventive health. Then it saves you money too if you have insurance.
Great stuff.
That's a big deal for so many folks that are covered but can't afford to use their insurance.
Huge. We're talking with Gary Drews, President and Chief Executive Officer of 365 Health, formerly the 9 Health Fair. And everything else with 365 Health is just like the 9 Health Fair? You're doing all the gatherings and your health fairs and the whole thing?
Oh, yes, we are. We are so grateful that the communities are coming back and running health fairs. One of the things that's really been enlightening these last couple of years during the pandemic is our human behavior really showed up. We stopped going to the doctor. We stopped getting health screenings. And in fact, this morning I saw a headline that said cancer screenings were down 80%.
Oh.
80. And so imagine, 2 years of a pandemic, and that much time has gone by and things have gotten worse for many people. But it's in our body. It's kind of like not knowing whether you got oil in your car. And we are discovering that chronic disease is really advanced. And so the health fairs are essential, especially in the communities we're going to get people engaged back in preventive health and get their screenings done. So starting this weekend, we have 4 health fairs in Colorado Springs and Denver and the mountains. We're all the way out in Lake City and Creed and Kiowa on the plains. And so we're getting these health fairs back out there, and just to remind folks, they're not only the lab screenings, but they can incorporate up to 3 dozen free screenings, everything from dental to vision to blood pressure and on and on.
Oh, good stuff.
Many things that make COVID more susceptible. And so it's really one of the things we really learned was chronic conditions make you more vulnerable to things like COVID.
Well, Gary, thank you for the time. And to find out what those fairs are, you go to the website, which is, what did you say, 365 Health? 365health.org?
365health.org.
That's it.
Right. We're a nonprofit and have been for 4 decades.
Oh, that's right.
And we're still around. We're still kicking.
Good enough.
We hope people will come on out.
Thanks, Gary, for the time. We appreciate it. Good work.
You bet.
Thanks.
Thank you.
And Jayla, we got to run. It's No Copay Radio, brought to you by Dr. Cog, the Denver Regional Council of Government's Area Agency on Aging. And we'll talk to you all next week here on KOSI 101.1.